So welcome to simulation. This is going to be your opportunity to practice some hands-on learning skills for ECMO. We've set up this bedside like we would for our program in the intensive care unit. You will have a ventilator with emergency vent settings posted, an intubated patient on BA ECMO. All of the scenarios will be run on an infant. You will have IVs running, medications. We have all of your pump components here. Again, our circuit as we would set it up in our program. We're going to provide you an opportunity to have hands-on time with the circuit. We want you, this will be your chance to get your baseline, what's normal for this setup. You will have a monitor which will give you real-time feedback for your physiological parameters. It looks a little bit differently than what we use in the clinical setting. So just eyeball right now where your heart rate is, blood pressure, sats. Your temperature will also be posted up there, and your CBP. To get you started, we're going to let you all do a circuit check, which is going to familiarize yourselves with the circuit. Everything that's on the ECMO circuit is on and running. The exception to that is the CDI monitor. So for the CDI monitor, we're going to hang some signs for you to reference. We also have daily parameters, so this would be like having doctor's orders. Gas flow, you have sweep gas, your pump is on, clamps at the bedside, flashlight, gloves, all the things you would need to do a circuit check. We have some scenarios that we're going to let you practice on. How they will work is you will come in, we will read you a background situation, you will be getting your baseline vital signs and pump settings, and then things will start to happen. And you will be expected to talk out loud and work through the scenarios. The important piece for you to remember is that you're going to need to talk out loud. We won't be able to read your mind, so we need you to talk through the steps. We need you to talk about what you're looking for. What are you trying to see in the circuit? Is it a clot? Is it fibrin? Do you think that maybe something's not working? You will get feedback from the facilitator, which would be myself, as well as you will have a confederate in the room that will be working with you on the scenarios. Don't panic. It's not a test. We want you to learn something that you can take back to the clinical setting and use in your practice in taking care of patients. When you finish the scenario, we will have a debrief and we will go over all of the teaching points that we want you to take away from your experience. Do you have any questions? No. Then let's start with the circuit check.